Good afternoon, and thank you for joining us for the final session of this incredible two-day summit. In a few minutes, we'll be hearing from three inspiring autoimmune patients, Victoria, Leela, and Brian, who will share their unique journey. My name is Indy Lee. My personal experiences with multiple autoimmune diseases and conditions, including a rare brain tumor, which I was originally given only 6 months to live with. Spoiler alert, I had successful surgery. Rheumatoid arthritis, early ovarian failure, vitiligo, and a recent diagnosis of Crohn's has taken me on an incredible life-changing journey. In fact, after learning more about my conditions and the struggles we as patients face, I became both obsessed and passionate about raising awareness and advocacy, and the importance of really patient advocacy, both with caregivers and your healthcare providers, that I joined the board of Autoimmune Association. I truly believe that by sharing our stories, we can not only amplify awareness and advocacy, we can also help others and their caregivers struggling with autoimmunity or struggling even for a diagnosis to see they are not alone. There is power in building a community. It is my honor to introduce you to our three speakers, Victoria, Brian, and Leela. I truly believe that you are going to be so inspired by their experiences. Victoria, who's living with ankylosing spondylitis, narcolepsy, Raynaud phenomenon, and several autoimmune and other conditions. Hello, Victoria.
Hello, thank you so much for having me.
I'd love for you to share your experience.
Yeah, so my autoimmune disease journey started back when I was 12 years old. At 12, I all of a sudden started to have really severe low back pain, and it persisted for months and months. I ended up missing the majority of my middle school years because I just felt like I had to be flat all the time. I went to multiple physicians, and all of the physicians kept telling me that there was nothing wrong, that I was making it up, it was in my head. And so there really wasn't much I could do. I was 12, 13 years old, and my parents were just as confused as I was. So we just kind of stopped going to the doctor, and I tried to deal with it the best that I could. By the time I got into high school, my back was slightly better, but I started having some really bad stomach issues. So those were kind of the main thing that I was trying to figure out what was going on. But in addition to those stomach issues, slowly over time, my back issues became really severe again. So by the time I was 18, I went to my physician myself and started telling them about all these symptoms that I was having, and that this severe back pain was really inhibiting my ability to be in college at that point. So they sent me to a rheumatologist, and over the course of a year, that rheumatologist did test after test after test in order to see if he could figure out what was going on. And the majority of tests kept coming back negative. Negative for inflammatory markers, negative for any other sort of autoimmune diseases. MRIs really mostly were negative. So he did a bone scan, and he also did a genetic test. So months later, he brought me back into his office. He said, "You have this gene called HLA-B27. You are positive for it. I think you have something called ankylosing spondylitis." So I was immediately put on a biologic IV therapy at the time, and within a matter of a couple months, felt completely better.
Wow.
Yes, I had a lot of other medical issues that I was still kind of trying to figure out, but for the most part, ankylosing spondylitis symptoms gone. I was dancing, I was singing, I was doing all of the things that I absolutely love to do. So I got through the entirety of college, and after college, I got married. And so getting married, I ended up on a new insurance plan and got out of this large HMO network that I had been in my entire life. So I needed to find a new physician. So I started with one rheumatologist. I said, "Hey, I've been on this IV biologic therapy. It's been working really well. Would you prescribe it? I have ankylosing spondylitis." That rheumatologist said, "No, I need to do my own test. I don't think you have it because you're a woman and you're under the age, you're not like the stereotypical patient that has ankylosing spondylitis, which used to be, they thought, men under 40. So he did all his tests and told me, you don't have ankylosing spondylitis. I'm not going to give you the medication. So I went to another rheumatologist, same thing. Another rheumatologist, same thing. Another rheumatologist, same thing. So by that point, because I was dealing with some other medical issues and pain issues, I kind of just said, okay, maybe they were wrong. Maybe I was misdiagnosed. So many years go by, about 8 years go by, and in 2017, by this point, I'm still not being treated. I'm not on any sort of medication for ankylosing spondylitis because I was told I didn't have it. So in 2017, my husband had just lost his job. He was at home, and I had just started a new job for the first time in a really long time. About 2 or 3 days into the job, I woke up one morning with the most searing pain possible in my eyes. I could not look at the light. My eyes were bloodshot red, and they felt horrible. So I made an immediate appointment to see an ophthalmologist. Went into the ophthalmologist. She looked into my eyes. After she looked into my eyes, she sat back in her chair and she looked at me and she said, so what else is going on, like physically? And I started thinking about it, and I thought back to many dinner conversations I had with my husband in the months prior. And I kept telling my husband that my back hurt like it did when I was 12.
Wow.
And it was at that point that it hit me that, oh, I was diagnosed with ankylosing spondylitis, but then like 5 different doctors told me I didn't have it. And she sat back and she very deliberately told me, do not let any physician ever tell you you don't have ankylosing spondylitis. You currently have uveitis and iritis, and that is prominent in ankylosing spondylitis patients. So it was at that point that I found a new rheumatologist who immediately put me back on that IV biologic therapy. And I started to feel mostly better. I mean, autoimmune disease is a journey. It's not always linear. And so for the most part, it has helped the majority of those symptoms. I've never had that iritis, uveitis ever again, which was really painful. And so I would say that patients out there that currently are suffering with autoimmune disease, maybe you've been diagnosed, maybe you haven't been diagnosed, that autoimmune disease is like a maze.
That's a great analogy.
Sometimes you hit some dead ends. Sometimes you are meandering through the maze for hours, but eventually you come out on the other side, if not only to enter another maze, but there is kind of that end that happens. And there are these chapters that we go through within our autoimmune disease journeys. And I would just encourage you to continue pushing forward. I know that it is terrible that when you are sick, you have to advocate so passionately for yourself, but unfortunately you do. And don't worry, there's a ton of us out here in this autoimmune disease community that are here to support you. So you can reach out to any of us that are on this panel today. We are here to give you compassion and love because we understand how difficult this can really be.
I love that. Thank you, Victoria. What a story and what an inspiration to go that long, though, from even when you said your childhood to then 18, only then to be told you don't have it, yet you tested for those markers, and then having to find that out and kind of re-diagnose yourself. That's incredible. So Leela is up next. Now, Leela was diagnosed with Sjogren's syndrome. I hope I said that correctly. Scleroderma and lupus. Welcome, Leela. I'd love for you to share your story.
Hello, everyone. Victoria, your story was just so powerful. I'm sorry to say that it took 17 years for me to get a diagnosis, and that is, I think, longer than most people. I was in my 40s, early 40s. I was working in New York at the United Nations, and I got an offer to go to England to do my PhD. So I went to England. It was very, very cold, and I just, I started to have really bad joint pain, and I couldn't write my notes down. And then my hair started falling out in these chunks. And, it was a dorm with all these young people, and, you share bathrooms, and it's embarrassing, and I was like, oh no, my hair. And then, you had to ride your bicycle down the hill, and then you'd get a stomach ache and you'd vomit. And then by the time you got up the hill to your dorm, there was no more food. And so, it was just this really difficult time for me. I had difficulty swallowing. I couldn't digest. I was constipated, and I just had stomach pain. And that was all like whatever. I have my advisors here, and I have to just meet her now. And like I wasn't even going to focus on my health. And then I started to forget things. And that was, I think, the most traumatic thing. I mean, because that's your livelihood, when you're going to be an academic. And it's like I read a book yesterday, and today I don't remember what it was in it, and I had never been very good at taking notes. And so I kind of lost my spirit for a bit.
Mm.
And then, but somehow I finished all my academic requirements, and I was able to leave England. I went to New York. Um, and then before I left, I was trying to get an appointment with the National Health System in Britain. And it was so difficult because I didn't know what I had. And so it like literally it took 6 months to see a general practitioner who was like, I don't know, and then, by the time I got to see a specialist, and the specialist they sent me to was a neurologist, 8 months had passed. And so I ended up going to New York, and in New York, they just bopped me around from neurology to immunology to oncology to endocrinology. And it was like I had like every workup, I mean, I can think of. And everybody said, oh, you definitely are sick, Miss Shahani, but it's difficult to say, good luck with that, have a good day. And that was my life. And, at that point, I had this silly idea that I'm going to know what I have. And then as soon as I have it, I'm going to cure it. And then I'm going to finish my PhD, and I'm going to go back to work in the UN. And it's as if it was just a blip. That was the plan. Okay, but that's really not what happened. And so in the process, they said, oh, you have Behçet's disease. And oh no, it's Ehlers-Danlos and Addison's disease. And at some point they said, oh, you have Lambert-Eaton myasthenic syndrome, which is this precancerous syndrome. And I was like, oh my God, oh my God. And so they said, oh, we need to biopsy your thigh. And at that point, I was in the Philippines to visit my family. They biopsied my left thigh and were going to send it to Mayo Clinic. And then they said, oh, the sample degraded. Would you mind if we biopsied your other thigh? I was
Oh
like,
gosh.
no. And so this went on and on. And my family members thought I was faking it. And it was like, she's just trying to get attention. And it was very, very lonely. And I think part of the problem was that I was always ANA positive, anti-nuclear antibody positive, but um, my blood work kept showing scleroderma, but my symptoms looked like lupus. And so they were like, well, it must be some neurological something or other. And so part of the problem was that had studied in was studying in England, and then I was working in New York, and I had family in the Philippines. And so there was so much traveling, and of course every doctor weighed in, which waylaid me, I think, significantly. And then I had a doctor say, look, Leela, what does it matter? I mean, why do you need to know what type of dog breed you are when the dog food is always the same? And so fast forward, I don't have very much time. So I ended up getting very, very sick in the Philippines. I decided that the only way out is to help other people who are worse off than myself. So I was helping all these human trafficking victims. And then I just ended up in the hospital, in and out all the time. So I finally moved to Seattle to be with my husband. And at that point, everything was so dry, and I kept telling my rheumatologist, I think that I have Sjogren's. And they were like, no, 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 you're not, your anti-SSA marker is just not yet showing up. It's all in your head. Fast forward 2022, I must have seen what, 13 dentists, and pretty much they said, your teeth are failing. I would have a fracture. I would have perfect teeth today and then have to have my teeth removed. Make a long story short, um, in May of last year, the dentists felt that, there was nothing to be done. They removed all my teeth. Um, and you can stop showing the slide. Thank you. So I was just to give you guys, it was very traumatic. May 2022, and then December they had to put bone, and then in June they had to put gums, and it was just like 4 surgeries. And I guess what I want to say is that I did not have any rheumatologist who knew anything about dental work. And I had no dentist who had the slightest interest in autoimmunity. And so obviously, this has taken so much out of my professional and personal life. And I instead of being embarrassed about it, I just decided to own it and accept it and be open about it and say it like it is. I don't have teeth, and there's another picture I want to show you, and that's what I did. It's not a great artwork, but it's some way I did to reclaim. I put it on my wall. I see it every day, and I say, "Hi, teeth." And
Wow.
so that's my
Leela, that's incredible. And I think something that you said really resonated, and I think will resonate with so many others who are watching this, is that you showed up with a marker of one, but you also presented with another. And I think that is so common, and what causes so much confusion in the autoimmune community is that you could test positive for lupus, but you can also have scleroderma, and they're going to present differently, and so the treatments have to be different, but it gets very confusing and makes diagnosis even that much more difficult. So thank you so much for sharing your journey, and I'm so sorry when I hear that it takes 17 years. It breaks my heart because I truly do understand that. And next, we have Brian, who is living with lupus nephritis, systemic scleroderma, and alopecia areata. I don't even know if I'm saying that right. Brian, thank you so much for being with us today, and I'd love for you to share your story.
Yeah, great. It's a pleasure to be here. So, everyone, my name is Brian Ong. I live in Los Angeles with my wife and our rescue dog, Ollie, who, if you're lucky, may make a cameo later. First, I just want to say, Victoria and Leela, you guys are both so brave for going through your journey and sharing, your experience with us today. My journey with autoimmune disease started when I was about 20. I was finishing up college, and started noticing something unusual, that my fingers were starting to turn blue. At first, I just brushed it off, thinking it was a quirk, just something was going on. I kind of ignored it. But as the months passed, my fingers turned blue more frequently. And at that point, I was like, I need to go see a doctor. And when I did that, similar to the stories that were shared earlier, I was really dismissed because, by the time I got into the doctor's office, I had been waiting in the office. It was a warmer room. So my fingers, weren't blue, and I couldn't, it's not like I had this magical power to just, turn them blue on command. So I was brushed off. They're like, you're young, you're healthy, you're probably just partying too much or something, which was ridiculous. But as the time went on, I noticed, things got worse. I really had really painful finger ulcers. And after visiting several doctors, getting rounds of tests, I now know that what I had was Raynaud's phenomenon, which I still have today, and was diagnosed with undifferentiated connective tissue disease. And I couldn't even tell you why what labs there were. That was just what I was given. And then that diagnosis transformed over seeing different doctors into scleroderma. And so that was extremely difficult time for me. I had these dreams of, graduating college, attending pharmacy school so I could help patients, having a fulfilling career, and then all around me, my friends were healthy. They were starting their jobs, traveling, living life to the fullest. And, here I was just, kind of saddled with this really serious, medical history or medical diagnosis. And I didn't know how to talk about it. So I kept it literally just to myself, my family. I took the medications, attended the appointments, but I was really silent about just how mentally draining and how sad and angry I was. I was just, why is this happening to me? Why at the age of 21 am I worrying about how my lungs are going to be in a few years, how my heart's going to be in a few years. And as an Asian man, I was just accustomed to this background where being vulnerable with your emotions, it just wasn't something that I saw a lot, right? Instead, I saw a lot of suppressing feelings, enduring pain and kind of silence. Strength was stoicism, kind of sucking it up and projecting, physical toughness, which was tough for me because I didn't feel strong. I felt really weak and angry and sad and just, however these societal expectations, which are wrong or ignorant, it just, that was what I was dealing with. And it made it even more challenging for me to open up about my struggles. I had friends that, I would hang out with and talk about, but even with them, it was, we didn't really talk about really what was bothering us, what were the real challenges in our life. And so, I didn't really have role models or examples about how to talk about my health and how to talk about how I was hurting and really scared inside. After the initial diagnosis, I was fortunate enough to have a kind of a treatment regimen where my symptoms were manageable. So I was able to finish pharmacy school. But then when I started my first job as a pharmacist, I had these episodes of really patchy hair loss, which was how I got the diagnosis of alopecia areata. And, until then, really the chief kind of symptom I had physically that you could see was my Raynaud's. And, the Raynaud's you can kind of hide, you get tricky, you learn how to, cover your hands, etc. But the hair loss was something, you can't really, you can't conceal that a hat, but, in professional settings, you can't do that. So it was really, I was extremely self-conscious, anxious about going outside and meeting new people, which was really hard in a professional setting and kind of starting my career. So, again, I felt really isolated and helpless. My most recent kind of chapter in this maze of autoimmune was during the pandemic. I had developed unexplained rashes. I had some swollen lymph nodes. My alopecia areata came back and flared up. I had these dark spots on my hands that I'd never seen before. And then things took a frightening turn when one day I had this really excruciating stomach pain. I noticed blood in my urine and just I knew something was wrong. So I had multiple visits to the ER, to the hospital before I got a diagnosis. And it was finally on my last hospitalization when I got a kidney biopsy that I was diagnosed with lupus and lupus nephritis, adding more to my growing list. And again, this was such a heavy blow because I'd been dealing with previous autoimmune diseases, and to have two more, and now thinking about my kidney, right? At kind of at this age, it was really, again, I had those feelings of isolation and fear. But this time, I think I approached things differently. I think I'd kind of grown a little bit older and wiser, and so I knew I needed the support. So I approached things differently. This time I reached out for help. I oversaw, went to disease support groups. I started seeing a therapist, and really these support groups, for lupus were really just a lifeline. Just being in a space where other people know what you're talking about, have the experiences. You don't have to explain things, where I could open up about my deepest fears. Like, how can I, raise children when I have these autoimmune diseases? How can I handle that?
Yeah.
These are things I thought about for years, but never expressed. So, it was just so great to be in that kind of, in those support groups. Today my journey consists of, a dozen pills daily, numerous visits, rheum, nephro, pulmonary, blood work, all of those things, pulmonary tests, echoes, not to mention some of the lifestyle modifications, the UV and eating healthy. But today I think I feel in a place where I'm more control, both physically and mentally. And I think a lot of that was due to being open about my health, connecting with people in the lupus community and other, like such as forum like this. I think being open, as an example, I participated in a lupus walk and had family and friends come out and donate and support. And that was just so inspiring, again, to meet other autoimmune warriors in person. And that was so uplifting. And I just want to end with, I realized my background in pharmacy and working in the pharmaceutical industry, gives me that perspective of that side, but also as a patient. And so that's really been one motivator for me to be so open about my journey, because I know I deal with a lot of, frustrations with the insurance companies, understand the medications, and I can only imagine people without that background, how difficult it is to advocate for yourself. So, I think my journey has had a lot of peaks and valleys, but really grateful for where I am today and for the opportunity to share my story with you all. So thank you.
Brian, thank you so much for sharing your story. And I can only say that as a patient, your I guess your community is, I'm sure, in great debt to you, because navigating these questions and being their pharmacist, I'm sure, is an invaluable benefit. And also, I want to point out something that you really spoke about, which is the importance of mental health and getting help. Having an autoimmune disease can be so isolating, and finding that community to help share your stories is literally a lifeline for so many. So I really, for those who are watching, I implore you to go out there and find different groups. And I think the Autoimmune Association is such a great community and portal for helping you find those resources as well. Your stories are also incredibly impactful, and I'm sure many of the people listening today can really relate in so many different ways. And you've all really demonstrated the importance of advocating for yourself and not giving up. That's a common thread here. So as we wrap up, not you, but as we wrap up, I was wondering if you guys have any final messages of empowerment that you would like to share. Just like a little quick minute. Victoria, if you wouldn't mind starting.
The good days are going to be there with the bad days, and you just kind of have to take it as it comes, and don't be too hard on yourself. I know that we can all really be hard on don't be too hard on yourself.
I love that. Leela, how about you?
I was really afraid. As a woman of color, I was so mortified when I would go into restaurants and I would take out my teeth and have to rinse my dentures, and people would gape at me and think I was addicted to crystal meth or something. And I was terrified of that, being judged, and I thought my husband would just not love me anymore if he saw me at night. But he didn't. He loved me more, and that was really wonderful. And so you kind of release all this vanity, and that was liberating. And the other thing I would say is that I was so obsessed with finding a diagnosis. And then at some point we couldn't find one. And so I said, I'm not even interested anymore. And I decided to help people who were less privileged than myself. And I got lost in that. And then at some point, my autoimmune disease caught up with me. And then I had to focus on myself again. And I guess my message is you really need a balance. Like, you can't forget yourself, but it really helps you to help other people. It's just a freeing thing, because the moment you find that accidental tribe, or that imagined community, it releases you. So as long as you have the balance.
That's amazing. And Brian?
Yeah, I'll just say, I think when we get a diagnosis or have symptoms, there's always that instinct to think your life will be different, and it will, right? And I think we always have those initial thoughts of it's going to be a bad different, but I don't think that's always true. And I think our autoimmune journey can lead to a lot of positive things that we can't even think of. So I'll say, accept that your life will be different, but it can also lead to some great positives and great people in your life.
I love that. Thank you guys so much, Victoria, Leela, Brian, for joining us today, for being vulnerable, for sharing your powerful stories. You three are an inspiration to the entire autoimmune community, and I wish you all the best with your continued journeys.
Thank you.
Thank you so
Thank you.
much.